I made this point on Friday. I'll make it again today. While we see positivity rate in the state of California growing modestly, we're seeing total number of cases certainly growing, a number of people losing their lives, and I'll talk about that in a moment, also growing. It's not happening evenly in every part of the state. There's certain parts of the state, certain regions in the state, and certain sectors of our economy that are disproportionately impacted by the transmission of this virus. We're here talking today about the Central Valley, 8 counties that have R-effective rates. Dr. Ghaly will remind you what R-effective is in a moment when he speaks. R-effective rates north of 1%. We have 8 counties where we're seeing an increase of infections. We have positivity rates in the Central Valley on the low end of 10.7% in Fresno, Tulare, and Stanislaus, on the higher end, 17.7% positivity rates. So you get a sense of the challenge we have in the 8 counties making up the Central Valley, disproportionately being impacted currently by community spread, and by spread happening disproportionately with essential workers, disproportionately in the Latino community, disproportionately impacting congregate settings, continuing to be vigilant around skilled nursing facilities, correctional facilities, and the like. That's the area of more of our laser-like focus in terms of our targeted interventions, in terms of our resource allocation, and in terms of our transparency and ultimately accountability to partner with organizations, both not only at the state level, local level, but also at the federal level to provide relief and diminish the spread and transmission of this virus. So today we're announcing $52 million investment, new dollars that will be put into the Central Valley, into the 8 counties to improve our isolation protocols, our quarantine protocols, our testing protocols, and to enhance our healthcare workers by providing more support as well as more personnel. $52 million that has been provided to us through a grant we received from the federal government, $499 million CDC grant, of which the first dollars we're now distributing, 52 again in the 8 Central Valley counties, focusing and targeting on improving testing, not only providing more supplies and supports, but time to testing results. And you'll hear a moment more from one of our co-chairs of our testing task force to talk more specifically about some of our renewed efforts in this space. But these dollars we think are timely. These dollars certainly are critical and important, and they will build off local infrastructure that's already in place.